So I feel Vigon is a company which is into medical devices, as you know. We are leaders in neonatology. We are leaders in arterial catheterization of the Seldinger type. And in fact, many of these areas we have created completely. So we are selling a product every fraction of a second. A product of Vigon is sold somewhere in the world. And India also is a very important operation for Vigon worldwide. We save thousands of lives of babies every day. Or maybe not thousands, hundreds of lives, surely. We save every day. And our contribution in continued medical education is huge. Every day, at least two of our workshops happen somewhere in the country where many doctors and healthcare workers come and learn from us the latest of procedures. And we are known as a company of dependable practices, dependable products, and dependable people. All companies say that about themselves, but in our case, doctors also say Vigon is Vigon.
Right. So here you are our French company, and we are in French healthcare summit. So what you discussed today in the panel discussion? So can we, in a nutshell, can you describe?
So, in today's panel discussion, there were leading hospital leaders from India as well as France. And what we discussed was what are the areas of collaboration going forward in research, manufacturing, training, uh, training, digital health, telemedicine, and so on. And we also discussed that how better exchange of the best from both medical fraternities can happen and how the linguistic barrier can be overcome so that these two countries who think alike and feel alike can also interact more fluently and more intensely to exchange healthcare insights.
That's great. Thank you so much, sir.
Pleasure, I think, talking to you. I started my new venture almost about 10 months back. That was what we called as Dr. G Lab or Dr. G Path Lab or DRG Path Lab. The idea was to get the new diagnostics, a new generation diagnostics, new next thought process to set up. Because that's something what I've been passionate is to bring something new to the diagnostics and probably take it forward. So today, if you look at the DRG Path Lab or DRG Dr. G Path, we have almost like 9 pathology labs, which is now scattered all across. We have a center in lab in Patna, Chandigarh, Gurgaon, 4 in Delhi, and of course the 2 more are setting up in Delhi NCR. So that is, I think, just those are not general pathology probably. They're all routine diagnostic in any case. So that's a part of it. Along with that, we have something what we call a new generation digital pathology, where we have a second opinion from national, international the experts, which can be done right at the doorstep wherever you are. Then we are talking about developing AI-based systems in the digital pathology, where you can have various algorithms and screening can be done by the systems, and probably that becomes a augmented intelligence to all my pathologists. Let me tell you something about pathology. I feel we have, it's a very, I always believe in skill. So we have topmost pathologists with you. We have some who are country's best out there with our team. The aim is to get the remotest part of the country, wherever there is nothing there, probably no skill, but the technology can go there, and from there the various inputs, quality, whether it's images or you can say the service can be centralized. And that's one part. So that's almost about 10 months old, and we have a fairly good presence. We're testing almost like 1,500 patients a day across the nation.
So, what is your next stage?
I think next stage is always like, when you have a startup, you like, at this point of age of my life, almost 35 years of my pathology, I thought of setting up a startup. So probably like, it's a very interesting in any case. So we have, the difficult challenge has always been investments. But now, luckily, I have, we started somewhere in month of 4 months back. The, the promoters of Intas Pharmaceuticals, who are like, they have a very chain of diagnostics for unipath specialties laboratories based in Ahmedabad. So they have become a shareholder in my DRG Path Lab. Now we have created a new group. They have taken some kind of shareholding with us, and now I'm partner, co-founder with them. So the aim is to bring the expertise of the skill and probably of the Unipath specialty, which is one of the largest chain in Gujarat. And of course, they have set up in somewhere in South also, but they're not in this part of the world. They are out. So this the collaboration between us will take us forward to the across North India, Central India, probably in Rajasthan, J&K, and setting up a new, probably this marrying of the skills, best of quality, and the service together. Because that's something I was impressed by the skill and the technology of the. They are all like highly skill-driven centers. Service is an integral part of it. So that's something the aim is. When we have the investment in, we have a bigger partner in with us. So it becomes easier for me to take my ideas to the next world, and I look forward to take it not only in the space of high-end diagnostics, genomics, molecular pathology, digital pathology, but also the space of wellness. Where today, if you look at the wellness part, it always talks about the value of a cholesterol, a value of hemoglobin and sugar. But no, I'm talking about giving personalized diagnostic, personalized health assessment or a health score for you. And this is going to be IT and algorithm driven, testing the integral part. It will not take time, but I think I'm very hopeful. I think we'll be able to lead our country to the what's already happening in the West. And hopefully, we are the first one today. And there are a couple of players here and there, but I think collaborating, integrating everything together, that's going to be my thought process, and look forward to make it a big success.
The opportunity for Indo and French healthcare to collaborate with each other, especially, for example, you look at areas of nuclear medicine where France is quite advanced, and the need for oncology and the isotopes in India is increasing. So I think if there is a way to increase collaboration in getting more and more isotopes to Indian patients, that's a good opportunity. The other opportunity for collaboration is in exchange program of doctors and nurses and other clinicians between India and France, where they can be fellowship, observerships, and we can enhance knowledge. The third area is in research, where, for example, we've been in India known very well for research in infectious diseases, and other global research projects are being done from India. So if there is a way to have collaboration for research projects, that will be another example. Just to share one example, that Oxford conducted a worldwide research from COVID and collected data on that, and we, for example, in Hinduja, we were the partners for Asia. So like that, we can be part of any global studies, and this kind of collaboration can really work.
We were discussing this in the morning panel. During the second phase of the pandemic, France came forward to help India by supplying medical equipment, and we were one of the beneficiaries of a oxygen generator, which helped us to take more patients and help many lives during the second phase. I think some of the areas that we can collaborate with France would be in the medical device space, in the small and medium enterprises, to help us in the journey which France almost is in it, because around 90% of their medical equipment manufacturing is done by the small and medium enterprises. We can also look at collaboration on the startups, on innovations, on entrepreneurship, because we have seen that India has now become a hub for our youngsters, both in villages, towns, and in cities. Youngsters looking for entrepreneurial journeys, youngsters looking forward towards innovations, and I think this is one space in which school to school, college to college, coming together to fuel this hunger for innovation. I think this is another space I think which India and France should look after. Some of the hindrances that were talked about in the morning were about the language barriers, but I think France is looking at it where the students who either are given some crash courses in French, or they welcome students who are not able to speak French. I think that will go a long way in pushing us into that space a little bit more closer. Thank you.
See, first thing is there's a lot of investment coming into this. Both public as well as private equity is coming into this. Secondly, the rules have been relaxed. Earlier, when you went for acquisition of equipment, it was a tedious process. All that has been streamlined. That is the second thing which has facilitated the provision of. Third is we are all aware, become more aware. Like we worked with Government of India to start a medical architectural course almost 15 years back. Only one university, Jamia Islamia, has started that. It's a full 2 years postgraduate course, 20 students. So now you have more than 200 medical architects who understand hospital buildings, who understand the complexities. So making a hospital has become easier because of their presence compared to routine architects who did not understand, and that time they will make a building and it will keep standing for 5, 7, 10 years before it could become a hospital. So these factors have contributed whereby now you are seeing more and more of hospital infrastructure.
See, the healthcare industry, I think it's a great opportunity in India. The healthcare infrastructure has to increase almost 100% or 200% in next 5, 10, 15 years. And I say always that this is one area where we will never see recession. So it is a good business sense for anybody to invest in healthcare, particularly in India, because in India the opportunities are more than anywhere else in the world. Like in United States or in Europe, the infrastructure is already developed, but India still has a lot of scope where we have to develop a lot of infrastructure in healthcare. So the opportunity is a huge opportunity for any investor. Particularly, I discussed with in the meeting today that how India and French people can get together and for the benefit of not only both countries but for the benefit of mankind. Because we can have a collaboration with the French doctors and Indian doctors to develop new strategies, new machinery, new equipment, new things in cardiovascular utilization. Why India is a good country to collaborate, and I just want to tell French people, because first of all, Indian doctors are highly competent. It is proven by even published data. Number two, Indians are very strong in IT. So computerization, processing of the data, maintenance of data, they can keep very well. And not only that, and we are now at a stage where we would like to do research methodology with the best in the world on the set patterns of the international research organization. So, like for example, if some doctor wants to do a new technology, new research on patients, they will not get so many patients. But India is a big country, so we can, if we collaborate together, we can have more clinical material. So there are a lot of kind of advantages of joining hands. Then the training of medical people, like technologies, nurses, technicians in healthcare, we can have a lot of advantage of joining both the companies.
So hi, my name is Mayur Sarvisa and I run a private equity healthcare impact fund called Somerset Indus Capital Partners, which invests across the healthcare space in India in growth equity companies.
So yeah, we didn't start with one hospital and we just started with a small 10 by 8 clinic, and that is the starting point of our journey. We started the first hospital, which was a very small one, and of course we didn't have any money to buy or build a hospital, we didn't have even enough money to pay rent to that hospital, so we started the first hospital on a revenue share model. And this model that was built out of constraint, various financial as well as skill constraints that we had, soon I think grew up into a very sustainable and efficient model, and this is the reason that we were able to expand so quickly towards our goal of providing high quality, low cost healthcare to communities that did not have access. So we have 19 hospitals now spread across 5 states of North India. We are in Uttar Pradesh, Uttarakhand, Haryana. We are the one and only corporate hospital in Jammu and Kashmir in the city of Srinagar, and we have 2 in the outskirts of Delhi as well. So our focus has always been since the very beginning on providing very high quality, low cost healthcare. Our RPOBs are less than 20% of the RPOBs of the big city chains that you see, the bigger comparable hospitals in terms of number of hospitals. The bigger chains, their RPOBs are at least 4x to 5x of what we do, but we are still very profitable. We run operations in a very sustainable manner, so it's like more than a 20% EBITDA margin that we are speaking about for ourselves as well. And we do very efficient and low cost operations. So our setup costs for the hospital, the initial capex is very low, so our return on capital is by far the best in the business, more than 40%, whereas that has been the traditional bane of all healthcare ventures, that the return on capital has not been good enough for even the most profitable centers because the initial capex is so high. We also, I think, have successfully managed to turn around the private sector healthcare model, which was earlier a low volume, high margin business. That has traditionally been what the private sector in healthcare has been all about. But we changed it completely into a very high volume, low margin business. So ensuring profitability, ensuring return on capital for our investors, but at the same time ensuring that the community gets very high quality healthcare at lowest possible cost.
So Gene Store has been around since 2011. We were assisted by the French embassy in Delhi to acquire a research laboratory in the south of France in a village called Geminos. We acquired this company in 2019 and we put together a plan to revitalize this company. In 2019 September, we converted this company into a manufacturer for RT-PCR based raw materials, and using the technology that we had developed, we brought this technology then to India, and we were the company that was responsible in lowering the cost of COVID-19 RT-PCR testing in India from 4,000 to 299 rupees. Today we have 2 research centers and manufacturing facilities. One is in France and one is in India, and we're focusing on 130 different types of bacteria, viruses, fungi which infect humans, and our primary focus is on the national mission to eradicate tuberculosis.
I am like a scientist. I got my PhD from the University of Paris 6, which is Sorbonne University, and I was a marine biologist at the beginning. And I discovered a molecule which is indeed the ancestor of red blood cell. And actually, we use this product, to make a different application. It's like a platform. We make organ preservation, giving time for organ to be transplanted in a longer time than we can do now. We have a product in wound dressing, dental care, transfusion, and everything about this unique oxygen carrier.
Please, can you elaborate more about this product?
Yeah. So Mr. Frank Zal's company Himarina has developed this product, which is Hemotolife, which is the extracellular hemoglobin of one marine invertebrate called Arancola marina. So it has a 400 times oxygen carrying capacity compared to the human blood, and once injected into an organ, it can keep it oxygenated.
Yes, I'm very pleased to be here. I'm Professor Raphael Vial. I am Chief of Staff at the Armand Hospital in the Department of Pediatric Orthopedics. And I joined the conference here for French-India healthcare cooperation.
So, what are the latest advancement in orthopedics? They are in Paris or France. So, would like to leave the technology to India, something special.
So orthopedic surgery is a functional surgery. I mean that we don't treat so many cancers or so many lethal disease, but we have a very we stress a lot the importance of functional results. So the main advances in orthopedic surgeries are hip prosthesis, knee prosthesis, joint replacement as a basis, and also we do a lot of spine surgeries to correct and to treat spine deformities. My job daily is to treat children and adolescents, but there is also a big field in orthopedic surgery related to the aging with very old patients with hip fractures or degenerative deformities.